No longer the death sentence it was once thought to be, medical advancements mean far better outcomes for people living with HIV. To tell us more, the chair of the British HIV Association, Dr. Laura Waters, joins me now. Laura, HIV treatment in the UK has been a phenomenal success, hasn't it? We should be celebrating this.
We absolutely should. And as you've said, from the start of the HIV epidemic, when people were experiencing essentially a terminal illness, the advances in therapy have transformed the outlook, meaning most people with HIV have a normal life expectancy. And importantly, effective treatment means they cannot pass HIV on to their partners.
Which treatments would you say have had the biggest impact?
It's hard to pick a standout treatment. Now, I think the biggest advance was the mid-1990s when we started using combinations of drugs. Prior to that, drugs only yielded short-term benefits, but by combining treatments, we were able to get the virus undetectable and keep it undetectable. Now, most people are on treatment they take once a day. In the future, we will have injectable treatments, maybe next year, and ultimately things like implants, which may need changing only once a year, and people do not need to worry about taking tablets every day.
Look, we've all been knocked backwards by the pandemic. What have the implications been for people living with the HIV of COVID-19?
So COVID-19 has had a huge impact on all health services, including HIV. Now, that has meant doing clinics by telephone or video consultation. It has meant less monitoring because we don't want people coming to clinic for blood tests unless they're absolutely necessary. And of course, all of the anxiety associated with COVID that everybody has lived through. But thankfully, we've been able to maintain services, and going forwards, there may be innovations that make HIV care better and more convenient for people living with HIV.
It's almost like you've been silently working on this brilliantly behind the scenes, because although treatments are hugely successful and results are brilliant, public awareness is lagging behind somewhat, isn't it?
No, it is. I think partly that's due to the fact that HIV remains a relatively uncommon condition compared to other long-term conditions like diabetes and high blood pressure. But there's still a lot of stigma surrounding HIV. People don't like talking about sex. People don't talk about testing for sexually transmitted infections. And I think because of that, HIV just doesn't have the public awareness that it should.
It's still surrounded by a massive stigma, isn't it?
And I think because of that, people with HIV aren't necessarily confident to share their status with other people. There's a lot of outdated myths about risk of transmission, and only by equipping people with up-to-date knowledge can we help challenge that stigma to make testing for HIV and living with HIV a normal thing.
For most of us, especially those of us over 40, HIV is intrinsically linked with that strong message that went out, "Don't die of ignorance," in 1986. That was an incredibly hard-hitting campaign.
It was a hard-hitting campaign for sure. I was 12 years old when the adverts with the icebergs and the gravestones and John Hurt's frightening narration appeared. Now, we would never run a campaign based on fear, and fear of HIV should never be a tool for prevention, but it probably did have an impact at the time in reducing new transmissions. We definitely need a new public health campaign, one that's based on fact and optimism rather than fear. But considering that was the last campaign we had, I think that is well overdue.
So what would the message be of a new campaign?
Any new campaign needs to be based on the positives, the normal life expectancy, the non-risk of transmission in somebody on treatment. Anybody who has had sex may be at risk of HIV, so everybody should test and know if they test, they can access treatment that will lead them to have a normal life.
Dr. Waters, thank you very much.